pulled that tube out, I've put a little bit of Vaseline or ultrasound gel on, or something on the tube, so that when I go to pull it out, it just sort of slides. You don't need to use that. That's just something that just makes it a little more easy. There is a little bit of a lump down the back now, so the scissors do slip up easy. You will be able to cut it up otherwise. So what we're going to do is just cut it right up the back. Again, this should be a little more hard, but you want to stay away from wrapping it too much around the back because it does get a little tighter and harder to cut. You're going to slip the tubing out and then cut the liner from up the back as well. I have seen people use X-Acto knives to cut it off too, but if I was a patient, I don't think I'd love that.
I don't know what you're talking about.
And then just pull it off their leg. So it's still wet. It does take about 15 minutes to fully dry, but it's wet enough that it shouldn't change shape. If I were to throw it into a box right now, it could potentially squish. So what they do is they take a picture. All the markings are on the inside, so they do take a picture from the inside of the cast. So if the outside of the cast looks horrible, as long as the inside of the cast looks okay. So
You leave the liner when you...
leave the liner in, yep. And that's literally all it takes to cast. So it does, like I said, takes 15 minutes to dry, so it's fully not dry right now. But once it's dry, it shouldn't break or bend or anything. Now with Amy's leg, she had a small leg. The bigger the patient you get, or the wider the patient you get, you will have to use more rolls of fiberglass. So again, another cost that it may cost, but those are usually the patients that you can't fit on the board. So it's kind of, just working it to price.
How many inches is that, 4 inches?
This one's 4 inch, yeah. We do have thinner ones too, but 4 inches usually.